Hair loss in women. Hair loss in women can be distressing and affect self-esteem and confidence. Unlike male pattern baldness, which is often more socially accepted, hair loss in women can carry a significant emotional burden. Understanding the causes and available treatments is essential for managing this condition effectively. This video explores the various causes of hair loss in women, discusses diagnostic approaches, and outlines potential treatments. Causes of hair loss in women. Androgenetic alopecia. Also known as female pattern hair loss, this condition is characterized by a gradual thinning of hair, particularly along the top of the head and the parting. It is largely genetic and involves the action of androgens, male hormones. Women may inherit this condition from either parent. Telogen effluvium. Telogen effluvium is a temporary form of hair loss that usually occurs after a significant stressor, such as surgery, illness, childbirth, or extreme weight loss. Stressful events push large numbers of hair follicles into the resting, telogen, phase, resulting in increased shedding and thinning. Alopecia areata. An autoimmune condition where the body's immune system attacks hair follicles, causing patchy hair loss on the scalp and other areas of the body. The exact cause is unknown, but it is believed to involve genetic and environmental factors. Hormonal imbalances. Hormonal changes can significantly affect hair growth and shedding. Common scenarios include pregnancy, childbirth, menopause, and thyroid disorders. Fluctuations in hormones such as estrogen, progesterone, and thyroid hormones can disrupt the hair growth cycle. Nutritional deficiencies. Deficiencies in essential nutrients can lead to hair loss. Important nutrients for hair health include iron, protein, vitamin D, and biotin. Poor diet, malabsorption issues, or certain medical conditions can lead to nutritional deficiencies that affect hair health. Physical or emotional stress. Both physical and emotional stress can trigger hair loss by affecting the hair growth cycle. Stress can push hair follicles into the resting phase, leading to increased shedding. Medical treatments and medications. Certain medications and medical treatments, such as chemotherapy, can cause hair loss. Chemotherapy drugs target rapidly dividing cells, including hair follicles, leading to hair loss. Other medications, such as those for high blood pressure or depression, may also contribute to hair loss. Hairstyling practices. Certain hairstyling practices, such as tight hairstyles, excessive use of heat, and chemical treatments, can damage hair and lead to hair loss. Traction alopecia results from constant pulling on the hair, while chemical and heat damage can weaken hair shafts and cause breakage. Diagnosing the cause of hair loss involves a thorough medical history, physical examination, and sometimes additional tests. Medical history and physical examination. Review the patient's medical history, including any recent illnesses, surgeries, significant life events, diet, and medication use. Perform a physical examination of the scalp to assess the pattern and extent of hair loss. Blood tests can help identify underlying conditions such as thyroid disorders, hormonal imbalances, and nutritional deficiencies. Thyroid function tests. Hormone levels, e.g., androgens, estrogen, progesterone. Iron levels and complete blood count, CBC. Vitamin D levels. A scalp biopsy may be performed to examine hair follicles under a microscope and determine the cause of hair loss. A small section of the scalp is numbed, and a sample of skin containing hair follicles is removed for analysis. Treatment for hair loss in women depends on the underlying cause. Here are some common treatments. Medications. Minoxidil, Rogaine. An over-the-counter topical treatment that stimulates hair growth and slows hair loss. It is FDA approved for female pattern hair loss. Finasteride, Propecia. An oral medication primarily used for male pattern baldness but may be prescribed off-label for women with androgenetic alopecia. It reduces levels of dihydrotestosterone, DHT, a hormone linked to hair loss. Spironolactone. An oral medication that acts as an anti-androgen, blocking the effects of androgens on hair follicles. It is commonly used for women with androgenetic alopecia or hormonal imbalances. Corticosteroids. Injections or topical corticosteroids may be used to treat alopecia areata by reducing inflammation and suppressing the immune response. Supplements such as iron, biotin, vitamin D, and zinc can help address deficiencies that contribute to hair loss. Healthy diet. A balanced diet rich in essential nutrients supports overall hair health. Include foods high in protein, iron, omega-3 fatty acids, and vitamins. Techniques such as yoga, meditation, and regular exercise can help manage stress and reduce its impact on hair loss. Gentle hair care. Avoid tight hairstyles, excessive heat styling, and harsh chemical treatments to prevent further damage and hair loss. Proper hair washing. Use gentle, sulfate-free shampoos and conditioners. Avoid overwashing to maintain the scalp's natural oils. Scalp massage. Regular scalp massages can stimulate blood flow to the hair follicles, promoting hair growth. Medical procedures. Platelet-rich plasma, PRP, therapy. PRP involves injecting a concentration of a patient's own platelets into the scalp to stimulate hair growth and improve hair thickness. Low-level laser therapy, LLT, uses red light to stimulate hair follicles and promote hair growth. Hair transplant surgery. Surgical procedures such as follicular unit transplantation, FUT, or follicular unit extraction, FU, transplant hair from areas of the scalp with dense growth to thinning or bald areas. Hair loss in women can result from various factors, including genetics, hormonal imbalances, stress, nutritional deficiencies, and certain medical conditions. Understanding the underlying cause is crucial for effective treatment. By adopting a comprehensive approach that includes medications, lifestyle changes, gentle hair care practices, and medical procedures, women can manage hair loss and promote healthy hair growth. Consulting with a healthcare provider or a dermatologist is essential to determine the most appropriate treatment plan based on individual needs and circumstances. If you received value from this video, please like, subscribe and comment.